So setup position for hip extension. You're going to be lying flat with one leg off the plinth or the surface that you're lying on. The green band or strap with no elastic tension is going to be around the bottom of the ankle. It's going to wrap up behind your back and then over your opposing shoulder. The left leg or the non-stretching limb is going to be in a flex position with your foot mounted flat. And then we're going to make sure that the back is flat against the plinth or the surface through activation of the lower abdominals. That is, you're going to try and bring your belt buckle up towards your belly button, and you're going to also engage your glutes. We'll kind of put you into what would be like a posterior pelvic tilt, and your spine will remain flat against the table. Once in that position, trying not to peel the back off the table, you're going to drop in this case, your right knee down towards the floor and moving into hip extension. The target tissue in question is going to be the front of the hip and or the thigh, depending on where the restriction is predominantly. The more knee bending that you get out of the strap versus the more hip extension of dropping the knee down will dictate whether you feel more quad or more anterior hip. In this case, we're going for more anterior hip, so we're less concerned about how deep of knee flexion that we're seeing. Once into the position, we're going to gradually stiffen our torso. So engage, put a little bit of pressure into the abs, push down with the opposite leg so we're nice and stable, and then we're going to gradually try and lift this thigh up against the resistance of the strap. Again, we may not actually move, but that matters not. What matters is that we're getting a targeted hip contraction in the appropriate tissue that we're trying to improve upon. And you would sustain that force output over the course of a minimum of 30 seconds. Again, the goal is not to relinquish the back, nor is it to actually get the knee to rise. It's more about the internal forces that derive from the hip contractile tissue. From here, you're going to then go into the opposite, where you're going to reestablish, if you've lost it, the back flat against the table, belt buckle up, and then you're going to drive this right leg into hip extension, almost like you're going to push that heel or the foot flat against the floor. And you will sustain that again for about 30 seconds. Continuing to maintain the position that you've established while continuing to exert the glute in this right hip. Repeating for anywhere between 2 and 3 cycles.